So I'm going to discuss about the altered mental status patient. We're going to lump these all together. We're using acronyms called AEIOU tips. I want you to review and go over this in your book, but basically A stands for alcohol, E is epilepsy or seizures, I is for insulin, so this is our diabetic patient. It could be high or low blood sugar. U is overdose, U is uremia. O is overdose. This could be in toxins or poisons. T is for trauma. I is for infections. P is for psych issues or behavioral emergencies. And then S is for stroke. This would also include the mini stroke or the TIA. So let's talk a little bit about stroke. Stroke is something that affects the blood vessels going to the brain, and this may leave the person incapacitated mentally. It will also leave some things that we're looking for, and so we use FAST. FAST would be, we're looking at the face to see if there's any type of facial droop on one side. So we ask the person to smile, and we would look to see if there's any drooping to the face on one side. Arms. We'd have them lift up their arms, and we'd watch to see whether or not their arm would drift to one side or the other side would stay up. Speech. We're looking to see if their speech is nice and clear, or is there any slurred type speech where they're not able to make out the words that they're trying to say. And T is for time, because we have a short window of time and opportunity to get them to the medical facility so that they get clot busting or thrombolytic drugs. Again, we would deploy things a little more than just your FAST. We would also use what is called the Los Angeles pre-hospital stroke scale, so LAPS. And we would deploy our own neurological exam. This would include orientation, name, date, and place of the patient. We would also check the pupils to see whether or not they dilate and constrict on both sides, and they should be equal and even. We also would ask them to smile for us so that we can see their face. We'd like them to stick out their tongue and move it from side to side to see if there's any tongue deviation. This may attribute to their slurred type speech, as the tongue is paralyzed and no longer able to clearly pronounce or enunciate those words. We'll also have them to do a hand grasp. We'll check the pulse, motor, and sensory of the arms or the upper extremities, and then we would do the plantar push and flex of the lower extremities, as well as we're checking for pulse, motor, and sensory distally in the lower extremities. When we have a stroke, this would occur affecting the opposite side. So if we have a stroke that's on the right side of our brain, it would usually leave the contralateral side. Contralateral is the opposite side. Moving on from stroke, we are going to talk a little bit about seizures or epilepsy. This is an abnormal misfiring of the electrons in the brain, causing the patient to have a tonic or clonic type activity. Now, that's a more generalized type seizure where they have also periods where they become post-ictal and they have no cognitive or memory of the event. We may have other types of seizures where they're simple and or versus our complex. Our patients that have been diagnosed with epilepsy would be on anti-epileptic drugs or anticonvulsants. So see if they are taking some of those. Remember that these medications do not terminate seizure activity, they limit the amount of seizure activity that they've had. Syncope or fainting spell, which is also not necessarily contributed to altered mental status, but it could cause the person to be altered during the event, is usually as a result of a lack of perfusion or blood flow that goes to the brain. As it could be a lack of blood volume, it could be an irregular heartbeat or a fast arrhythmia that causes the intermittent blood flow to the brain, causes them to feel lightheaded and then losing consciousness. So syncope is maybe sometimes a symptom of what might be underlying. Again, it could be a fluid problem such as dehydration or severe blood loss, or it could be an abnormal heartbeat such as an arrhythmia. And this could be a tachy or fast arrhythmia, such as VTAC or a rapid atrial fibrillation, or it could be a slow heart rate or bradycardia, such as a heart block or sinus brady. As we move down through the altered mental status, there's also diabetes. A diabetic patient is one that has a problem with their pancreas. The pancreas no longer secretes insulin, or the insulin itself is not functioning, or that the pancreas has worn out its ability to make the proper amount of insulin over time. As a result, the patient now has been given injections to increase the blood sugar, increase the metabolism and utilization of the sugar that's in their body. Now, we have two generally diabetic conditions. One is low blood sugar or hypoglycemia. Low blood sugar or hypoglycemia. In this case, the patient has taken too much insulin. They've taken too much of their own insulin and then failed to eat. They may have increased their physical activity, which allows the muscles to draw in the sugar, and it rapidly declines the amount of sugar that's circulating throughout their body, so the insulin levels are high, and their mental status starts to deteriorate and change. They become disoriented, confused, combative. Their skin becomes pale, cool, and diaphoretic. And this occurs in an acute onset. When we check their blood sugar using a glucometer from a finger stick or capillary blood supply, we will find that their blood sugar is less than 70 millimeters per deciliter or milligrams percent. This may change depending on what system you're using, but anytime that it's below the normal range, we're thinking about that being that it's a hypoglycemic event. The treatment for this would be managing their sugar and replacing this either through oral glucose, intravenous, or an IM injection of glucagon. The other diabetic event is called the hyperglycemic event. This is in regards to having too much blood sugar and not enough insulin. Hyperglycemia. High blood sugar. In this case, when we check the glucometer reading, it'll be way above the normal reading and read sometimes even high. They have an over-excess of sugar that's circulating throughout the blood supply and insulin levels that are too low for the body to utilize all this sugar. In any event, the body systems are recognizing that there's not enough sugar because the insulin is not there to allow these body systems to utilize the sugar. And as a result, we develop new ways of generating glucose or sugar stores for production of energy. This is called gluconeogenesis, in which case we are now breaking down more than just our storages of sugar from glucagon to glycolysis. We are now breaking down fats and muscle. As a result, this is very inefficient and is causing a metabolic disarrangement. What it means is that we're basically causing a lot more acid to build up into the body. And so signs and symptoms we'll see for hyperglycemia is that it's an insidious or gradual onset of the symptoms. The person will become a little more flush and dry versus being pale and cool and diaphoretic. They'll also have what sounds like small respiration, so they're breathing quite fast, a little more than 20 times per minute, but not necessarily so hyperventilated. So when you see these patients, it may look like they're having difficulty breathing. They may also have a fruity acetone odor to their breath as they're breaking down fats, and this is just coming back up and you can smell this acetone smell. One of the three indicators that we look for is called the 3 Ps: polyuria, polydipsia, polyphagia. Polyuria is the need to constantly urinate, and this is a result from the body trying to rid itself from all that high sugar that's in the bloodstream. So the kidneys are trying to excrete all of this excess sugar as it no longer needs it, but remember, it's that the body systems are not able to utilize it because there's no insulin. Polyuria. Polydipsia. Because this urine is being produced, a lot of fluid is going out with the sugar. And as we urinate all of this water out, the body becomes very thirsty and we need to dilute all of the sugar. Polydipsia, increased thirst. And as a result of our blood sugar not being recognized as high, we have polyphagia, which the body identifies as we need to eat more. So we look for those 3 P's as we develop our history, taking skills, and as we do more assessments.